Hi, my name is Holly, and I am a patient solutions advocate here at Phoenix Spine and Joint, and today I'm going to discuss with you arthroscopic rotator cuff repair. One of the most common reasons I see that patients call in is for shoulder pain. They tell me they're unable to lift their hand above their head. They have trouble getting dressed. And one of the most common things I hear is that their shoulder pain is excruciating at night, that they have been unable to get a good night's sleep in weeks. We're going to ask for a couple of things. The first is going to be an x-ray of your shoulder, and that is going to rule out any arthritis or fractures in your shoulder. And depending on what that x-ray shows, we might also ask you to get an MRI of your shoulder, and that is going to rule out any tears in your shoulder. Now, there are two types of tears. There's a partial thickness tear and a full thickness tear. A partial thickness has the ability to heal on its own, but after about 6 to 8 weeks, if it has not healed, we would need to look into some surgical options for you. Now, for a full thickness tear, it does not have the ability to heal on its own and will require surgery. Here at Phoenix Spine and Joint, we are a minimally invasive spine and joint surgery center. All of our surgeons are board certified and specialize in minimally invasive surgery. So for a rotator cuff repair, the surgeon will make a small incision, just big enough to fit the camera in so they are able to visualize your rotator cuff, sew and repair the rotator cuff, and restore function back into your shoulder. And because we are an outpatient surgery center and your surgery was done minimally invasive, you will be walking out of that surgery center that same day, and your recovery process will be a lot faster and a lot less painful. Now, even just in that first week, you are going to notice how fast of a recovery you are going to have. You're going to feel a lot more stable. Now, your full recovery will take about 6 to 8 weeks. And once approved from your doctor, you'll be able to get back into the swing of things, whether that be golfing, gardening, any things that you enjoy that your shoulder has stopped you from doing prior to having this surgery. All of our patients are COVID tested prior to surgery. Our surgical team, surgeons, they are all COVID tested regularly because here at Phoenix Spine and Joint, your safety is our number one concern. So I look forward to hearing from you and answering any additional questions that you might have for me. Thank you and have a nice day.